Welcome. This video will demonstrate the physical examination of the hip. Sometimes with our lumbar exam we include the hip. This is going to be more specific to once we've ruled out the lumbar spine. This is specific to the hip of itself, and we suspect that that is the area where their pain is coming from, or the most problematic area. We'll examine that really closely. So Rob, I'm going to have you go ahead and lie down, please. Face up. And the supine position is a really good way to assess the range of motion of the hip. The only downside is it's difficult to assess hip extension from this position. If I were concerned of a hip extensor problem or issue with that, I would specifically examine that. But usually that's not very common, so we kind of omit that from our exam. Rob, can I have you bend your knee here? Good. So first what I'm going to do is assess for range of motion of the hip, and this range is called internal rotation. This range is external rotation, and he's got no limitation there. If he did, I would call it out. For instance, if I could only get it to move to here, I would say hip internal rotation limited by 15 degrees. Next, we're going to check for hip flexion. So just again, go ahead and relax. Just relax. And I'm going to bring the hip up towards his chest. Hip flexion is normal for him. For some people, they can only flex to here. I would say hip flexion limited at 90 degrees. The next test is something that we see pretty commonly, and we'll try to rule it in or out, would be for a hip labral problem. And the test for that is called anterior impingement. So it's similar to hip flexion, but what I'm going to do is I'm going to add a little internal rotation, and I'm going to bring him in. I'm going to adduct the hip a little bit. What this does is it puts the femoral head in a position to impinge on the acetabular labrum. So if they have a tear there, at least in the anterior part of the labrum, it would likely reproduce their symptoms. So I'm just going to hang out here for a second and apply a little bit of pressure. Any pain there? Good. So again, it might be difficult to see. This I'm assessing hip flexion. This I'm assessing anterior impingement. Okay? So we'll mark it as a negative. Another hip test similar to what we did on the shoulder, the crank test, where we're rotating the ball of the humeral head. We're going to do that similarly for the hip. And for the hip, it's called scour, hip scour. So we're just going to go 360 degrees around and see if that produces any symptoms. Any symptoms with that? Great. So scouring negative. We'll make a comment if it's positive. Another common area of hip pain would be in the lateral aspect of the hip. Some structures that live here are the gluteal tendon insertions and the GT bursa. A lot of people have heard of trochanteric bursitis or GT bursitis or hip bursitis. Usually they're speaking of GT bursa inflammation of the lateral hip. So this can be assessed with him lying down, or it can be assessed with him standing. But if you see the clinician digging their thumb in on the side of the hip, let's see where we're at here, like right here, any symptoms with that? So he's non-tender to palpation at the GT bursa. And again, keep track of laterality. So here I'm palpating his left. If I were over here, I'd be palpating his right. So he's non-tender at the bursa itself. Then I'm going to kind of move into the tendon. Tender there. Okay. And here. Okay. So the tendons that attach there are the gluteus minimus and the gluteus medius. We'll call that out if it's tender. In the IMS exam flow, just be sure to mark it negative that if we did palpate that area. So that is basically most of the structures that we'll be examining for the hip. Similar to the lumbar spine exam, we may test Faber as well. That gives us a little bit of information. So just a review of the Faber test. We're going to ask him to make a figure 4 with his heel crossed over his knee, and we're going to push down like that. Any pain with that? Okay, that's Faber. So that concludes the hip exam. Thank you.